Hello people, this is Kerry Anderson. Hope you all doing well. In today's video, we will be talking about diabetic coma. So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon so you will get the videos. Okay, so here we begin. Let's go. A diabetic coma is a life-threatening disease complication that causes unconsciousness. If you have diabetes, dangerously high blood sugar, hyperglycemia, or dangerously low blood sugar, hypoglycemia, can lead to a diabetic coma. If you lapse into a diabetic coma, you are alive, but you can't awaken or respond purposefully to sights, sound, or other type of stimulation. Left untreated, a diabetic coma can be fatal. The idea of a diabetic coma is scary, but you can take steps to help prevent it. Start by following your diabetes treatment plan. Symptoms. Before developing a diabetic coma, you will usually experience signs and symptoms of high blood pressure and the low blood sugar. High blood sugar, that is the hyperglycemia. If your blood sugar level is too high, you may experience increased thirst, frequent urination, fatigue, nausea and vomiting, shortness of breath, stomach pain, fruity breath odor, a very dry mouth, a rapid heartbeat, low blood sugar, hypoglycemia. Signs and symptoms of a low blood sugar level may include shakiness or nervousness, anxiety, fatigue, weakness, sweating, hunger, nausea, dizziness or lightheadedness, difficulty speaking, confusion. Some people, especially those who have had diabetes for a long time, develop a condition known as hypoglycemia unawareness and won't have the warning sign that signal a drop in blood sugar. If you experience any symptoms of high or low blood sugar, test your blood sugar and follow your diabetes treatment plan based on the test result. If you don't start to feel better quickly or you start to feel worse, call for emergency help. When to see a doctor. A diabetic coma is a medical emergency. If you feel extreme high or low blood sugar sign or symptom and think you might pass out, call 911 or your local emergency number. If you are with someone with diabetes who has passed out, call for emergency help and be sure to let the emergency personnel know that the unconscious person has diabetes. Causes. Blood sugar that's either too high or too low for too long may cause various serious conditions, all of which can lead to a diabetic coma. Diabetic Ketoacidosis. If your muscle cell becomes starved for energy, your body may respond by breaking down fat store. This process forms toxic acid known as ketone. If you have ketone measured in blood or urine and high blood sugar and the condition is called diabetic ketoacidosis, left untreated, it can lead to a diabetic coma. Diabetic ketoacidosis is most common in type 1 diabetes but sometimes occur in type 2 diabetes or gestational diabetes. Diabetic hypersmolar syndrome. If your blood sugar level tops 600 milligrams per deciliter or 33.3 millimoles per liter, the condition is called diabetic hypersmolar syndrome. Severely high blood sugar turns your blood thick and syrup. The excess sugar passes from your blood into your urine, which triggers a filtering process that draws tremendous amount of fluid from your body. Left untreated, this can lead to life-threatening dehydration and a diabetic coma. About 25 to 50% of people with diabetic hypersmolar syndrome develop a coma. Hypoglycemia. Your brain needs glucose to function. In several cases, low blood sugar may cause you to pass out. Hypoglycemia can be caused by too much insulin or not enough food. Exercising too vigorously or drinking too much alcohol can have the same effect. Now, we will be talking about the risk factors. Anyone who has diabetes is at risk of a diabetic coma, but the following factors can increase the risk. Insulin delivery problems. If you're on an insulin pump, you have to check your blood sugar frequently. Insulin delivery can stop if the pump fails or the tubing is twisted or fall out of place. A lack of insulin can lead to diabetic ketoacidosis, an illness, trauma, or surgery when you are sick or injured. People's blood sugar level tend to rise sometimes dramatically. This may cause diabetic ketoacidosis. If you have type 2 type 1 diabetes, and don't increase your insulin dosage to compensate. Medical conditions such as congestive heart failure or kidney disease also may increase your risk of diabetic hyper syndrome. Poorly managed diabetes. If you don't monitor your blood sugar properly or take your medication as directed, you all have a higher risk of developing long-term complication and a diabetic coma. Deliberately skipping meals or insulin. Sometimes people with diabetes who also have an eating disorder choose not to use their insulin as directed with the hope of losing weight. This is a dangerous, life-threatening practice that increases the risk of a diabetic coma. Drinking alcohol. Alcohol can have unpredictable effects on your blood sugar. Alcohol's sedating effect may make it harder for you to know when you are having low blood sugar symptoms. This can increase your risk of a diabetic coma caused by hypoglycemia. Illegal drug use. Illegal drugs such as cocaine and ecstasy can increase your risk of severe high blood sugar level and condition linked to diabetic coma. Now, what are the complications? Left untreated, a diabetic coma can lead to permanent brain damage, death. Precautions. Good day-to-day control of your diabetes can help you prevent a diabetic coma. Keep these tips in mind. Follow your meal plan. Consistent snacks and meal can help you control your blood sugar level. Keep an eye on your blood sugar level. Frequent blood sugar tests can tell you whether you are keeping your blood sugar level in your target range and alert you to dangerous high or low. Check more frequently if you have exercise, because exercise can cause blood sugar level to drop even hours later, especially if you don't exercise regularly. Take your medication as directed. If you have frequent episodes of high or low blood sugar, let your doctors know. He or she may need to adjust the dose or the timing of your medication. Have a sick day plan. Illness can cause an unexpected change in blood sugar. If you are sick and unable to eat, your blood sugar may drop. Before you get sick, talk with your doctor about how to best manage your blood sugar level. Consider storing at least 3 days worth of diabetes supply and an extra glucagon kit in case of emergency. Check for ketones when your blood sugar is high. Check your urine for ketones when your blood sugar level is over 250 mg or more than 2 consecutive tests, especially if you are sick. If you have a large amount of ketones, call your doctor for advice. Call your doctor immediately if you have any level of ketone and are vomiting. High level of ketone can lead to diabetic ketoacidosis, which can lead to coma. Have glucagon and fast-acting sources of sugar available. If you take insulin for your diabetes, make sure you have an up-to-date glucagon kit and fast-acting sources of sugar such as glucose tablets or orange juice readily available to treat low blood sugar level. Consider a continuous glucose monitor, especially if you have trouble maintaining stable blood sugar level or you don't feel symptoms of low blood sugar. CGMs are devices that use a small sensor inserted underneath the skin to track trends in your blood sugar level and transmit the information to a wireless device. These device can alert you when your blood sugar is dangerously low and if it is dropping too fast. However, you still need to test your blood sugar level using a blood glucose meter, even if you are using a CGM. CGMs are more expensive than conventional glucose monitoring method, but they may help you control your glucose better. Drink alcohol with caution, because alcohol can have an unpredictable effect on your blood sugar. Be sure to have a snack or a meal when you drink. If you choose to drink at all, educate your loved ones, friends and co-workers. Teach loved ones and other close contact how to recognize the early signs and symptoms of blood sugar extreme and how to give emergency injection if you pass out. Someone should be able to call for emergency help. So that's all about the diabetes in this video. I hope you all liked it. So before ending this video, I would like to request you all, please do subscribe the channel and hit the bell icon so you will get the notification. So that's all. We will definitely meet in the next video with my another content. Till then, God bless you. Bye bye and take care.